Hello, my name is NMOORE. I am a nursing student at Indiana State University, and I am doing a health education project today called Free Needle Exchange Program, and it is to inform the community of the advantages of clean needle exchange, including IV drug users and those in a community who are affected by the opioid crisis. Learning objectives for today's program include define needle exchange program, describe how bloodborne pathogens, also known as BVP, are transmitted, understand dangers of sharing needles, and to examine current needle exchange programs. At this time, please take out the pre-test that was provided. Free needle exchange programs, also called syringe services programs, are part of the effort to combat the opioid crisis that's happening in the nation and also to deter HIV and hepatitis epidemics. The SSP, which is abbreviated for Syringe Services Program, are community-based programs that provide pathways to services to prevent drug use and the transmission of those bloodborne pathogens. The free needle exchange programs have been around for quite some time and started in New York City back in 1990. But it wasn't until 2016 when the Consolidated Appropriations Act gave states and local communities federal funds to support syringe service programs. So a syringe service program is basically where an IV drug user can bring in their contaminated needle or needle that they have used and safely dispose of that needle and receive a free sterile needle and syringe. Now, this is the only part of the government fund that is not funded, and that's due to the free needle and syringe being considered paraphernalia. So the government can't fund drug paraphernalia. The rest of the items that the syringe service programs offer are all funded by the government, which include referral to mental health services and substance abuse disorder treatment, including medication-assisted treatment. They offer HIV and hepatitis testing, and also link you up with treatment for those viruses. They offer other tools to prevent HIV and hepatitis spread, including counseling and condoms. They offer hepatitis A and B vaccination and opioid overdose treatment and education. Now, some people are under the impression that syringe services program will increase the use of illegal drugs and crime, but it actually does not increase the illegal drug use, and people can use these services to get help for their addictions, and it has also proven to reduce HIV and hepatitis risks and outbreaks. So what are bloodborne pathogens, also known as the BVPs? These are viruses that are contracted from blood-to-blood transmission, and they include hepatitis, HIV, brucellosis, syphilis, and malaria. Our main focus today is to discuss the hepatitis and HIV. They're the most contracted BVPs from IV drug use. So how are BVPs transmitted? Well, they are transmitted from sharing IV drug needles. So if you and your friend are injecting drugs via a needle, and your friend is infected with HIV or hepatitis C, and you use that needle after they have, you are now susceptible to not only the drugs that are injecting into your vein, but the bloodborne pathogen as well. An accidental needle stick which could be a healthcare worker or even an IV drug user, having unprotected sex, and receiving a blood transfusion, which is very rare nowadays, that is infected with one of those viruses. So to decrease your risk in the transmission of bloodborne pathogens, you should wear a condom when having sex and always use a clean, sterile needle. So the free needle exchange program is a great way to ensure that you have a safe, free needle to use each time that you inject. Sharing needles is the #1 way of transmitting bloodborne pathogens in the United States. So as I mentioned before, New York City was the first free needle exchange city in the nation, and this graph shows the incidence of HIV and hepatitis C during the 1970s and 1980s. And this was before people realized what bloodborne pathogens were, before people even knew what HIV was. And so in that decade, the incidence of IV drug users that had HIV and or hepatitis C virus were 90% for both. So in 1990, the free needle exchange program started in New York City, and you'll see that the incidence of HIV went down to 50% and hepatitis C went down 80%. Fast forward to 1990, HIV was down to 17%, hepatitis was down to 59% among IV drug users, and then all the way through 2012 continued to decline. HIV was 15%, hepatitis C was at 35%. Now those levels are beginning to go up with the current opioid crises. So those of you who are actively IV drug users may be wondering how this affects you. Well, it affects all of us related to healthcare costs. And the healthcare costs for hepatitis and HIV are very costly. And the majority of IV drug users are utilizing some sort of government insurance. This graph shows that about 90% of IV drug users are covered under Medicare and Medicaid, which are government funded, which utilizes our tax dollars. And then a little less than 2% of IV drug users have private insurance, and a little over 9% of IV drug users have no insurance at all. IV drug users that contract HIV and or hepatitis C cost about $1,300 to $3,000 in health care annually.
I would climb
There was a cost-effective analysis done, and if we invested $10 million into these free needle exchange programs, it would be a lifetime health care savings of $75.8 million nationally. In New York City alone, 194 HIV infections would be averted annually. This would be a return on an investment of $7.58 for every dollar spent nationally. Now that's a great return on your investment. If you're currently an IV drug user, I would strongly urge you to utilize the free needle exchange programs in your community. They will be a great asset to you. And for the rest of you, I would hope that you would support free needle exchange in your community. I have a brochure with links to additional literature and resources if you would like to receive more information. And the CDC is a great resource. Thank you.